I'm delighted to be welcoming in a gentleman by the name of Barry McGrath, who's a patient advocate, patient research partner, and co-founder of HS Ireland. And HS, Hidradenitis Suppurativa, or HS for short, is an often overlooked painful long-term skin condition that causes skin abscesses and scarring on the skin. And the exact cause of HS is unknown, but it occurs near hair follicles. I got the hard word right, and I got that wrong. The hair follicles, which there are where there are sweat glands such as the groin and armpit. Barry, thank you so much for joining me. I hope you're well.
Very well, Joel, and you nailed the pronunciation.
Superb. I've never been so sweaty at the start of an interview.
The 23 letters and 10 syllables that comprise hidradenitis suppurativa don't exactly roll off the tongue. We call it HS for short in the community.
Brilliant. And that will be what I will use for the rest of the show.
Yeah. Sounds like a good plan.
Yeah. And also the Norfolk accent didn't seem to lend itself to them two words either. We add in lots of extra vowels that are not needed. So I'm glad you approved. But welcome in, Barry. Thank you so much for joining us. Obviously, I've got to know you quite a bit over the last few weeks, but for anyone that isn't aware of what you do you want to give us like a little overview of who you are, where you're from, and then we'll go on from there?
Sure. Greetings from the west of Europe. I'm on the west coast of Ireland. I'm a former scientific clinical researcher who, just as I was embarking on my career, I got diagnosed with this long-term condition after about a 20-year delay of looking for answers. That's a common story, unfortunately, with HS, this long diagnostic delay due to poor awareness. So first things first, thank you very much for helping raise awareness and talking about this condition. When I do talk about HS, there's a quote I love to cite, and that's from Oscar Wilde, who wrote in the Picture of Dorian Gray, there's only one thing worse than being talked about, and that's not being talked about. And that has been the case with HS. It's one of the reasons why awareness is so appalling. When I was diagnosed, I was working in scientific research. It was all a bit too much. I stepped away from the scientific research, and in one of those completing the circles that so often happens in life, I spend most of my spare time researching and then getting involved in HS awareness, advocacy, education programs, things like that. By day, I'm a writer with a clinical research organisation focusing on creating content specifically for patients, converting the technical language into plain language so that everybody can understand it. Really enjoy that because I'm learning all the time about new diseases, new conditions, new medicines in the pipeline. It's really exciting, always learning. In terms of HS, we saw a huge need for someone to do something about HS. And in parallel with many of my colleagues around Europe and internationally, set up a patient organisation to work together with researchers, try and increase awareness about this condition, try and improve things, because there are many unmet needs with regard to HS. Up until quite recently, there was just one approved medicine for HS, which when it works, it works well in some people, but that's the problem. It only works in a small proportion of people, and there's a huge need for more medicines, more awareness of the condition, and so on. So that's me in a nutshell, Joel. Thanks again for the introduction and for doing this about HS.
Oh, it's an absolute pleasure. And thank you so much. There are so many questions there because the more I've looked into you and got to know you, Barry, the more levels I've found. And there's so many fascinating things you're working on. And I think I first became aware of HS, just for the audience watching, people listening to this back, is we had a really popular interview with Dr. Eleanor Chatburn that was on for World Psoriasis Day. And I was chatting to her on social media, and she says it's a really overlooked condition. And I must admit, it completely wasn't on my radar. I've seen a few people talking about it on LinkedIn, some sort of quite prominent people I follow on LinkedIn, but it as a condition itself, it wasn't on my radar. And so I suppose the two questions is one, is that the case, or is that just my sort of perception? And also, like, do you have any sort of idea why you think that might be?
It is an overlooked condition. With a dear friend and fellow patient in Ireland, Suzanne Maloney, we give healthcare awareness talks. We target healthcare students at third level institutes. And one question we always ask at the start is, how many of you have heard of psoriasis? How many have heard of eczema? How many have heard of HS? And it's usually all or most versus none. are very few. Now, the reason we compare and ask about the psoriasis eczema is that roughly the same number of people are affected. Psoriasis and the psoriasis people like IFPA that we were discussing earlier on
Yeah.
done tremendous work in making people aware of psoriasis and its impact, and so much so that the dog on the street knows about psoriasis at this stage. And that's what we aspire to doing. I mean, the psoriasis community done fantastic work, and they're the icons on the wall that we aspire to, and we want to get that type of recognition. It definitely is overlooked, and one of the reasons why this is the case is, well, I'll break this down to several parts. Because of the terrible shame and embarrassment associated with HS, people with HS tend not to talk about it. It is by and large an invisible illness. We can hide it because of where it affects us in the body. As a result, we can visually hide it, but we also don't talk about it. And that leads to huge psychological problems in coming to terms with having this effectively for life. Because it hasn't been spoken about and because we haven't really vociferated our needs and whatnot, it's compounded within the medical community. There's poor awareness there. There's a poor awareness of how it impacts people. And can be an absolutely devastating condition in terms of the impacts on a person.
Right.
Physically, a large proportion of people end up disabled or temporarily disabled at some point, but it goes way beyond that psychologically. As with many other chronic conditions, the relentless nature of it can drag you down, and there are huge societal impacts as well. And if there have been approaches before to try and raise awareness, but if you're going to do it, you've got to target each of those areas: the person, the individual affected, the medical community and society. And you've got to take a multi-pronged approach to make sure that all dots are connected in this. Otherwise, it's not going to work and it's going to fail.
Yeah, that relates. I can relate to a lot of that as somebody that's got a type of psoriasis that's not like really prominent, or maybe not the type of psoriasis that people associate with psoriasis, and trying to get across that sort of mental burden of having this long-term health condition, and that there isn't any fix and it's not going to go away. And just because you can't see it, it doesn't mean it's not having an impact on the individual. It sounds like there's a lot of crossover there, and I don't know. It reassures me that you're talking about that collaboration and looking at what other people are doing, because, like we've talked about this in the past, but it feels like sometimes we don't, lift each other up where we can. And I think it's really important what you're trying to do, and sort of that best practice from what's going on elsewhere. And so, thank you for that. And I'm glad we can help sort of raise awareness of it here. Are you okay talking a little bit about your own personal experience with
course,
HS? And maybe,
of course.
because I'd just be interested to know how it onsets, because I'm in the dark with this. So I'd be interested to know what that experience was. And I believe, diagnostic delay is a bit of an issue with the condition itself, isn't it?
Yeah, sure. I just started secondary school when it all started for me. I woke up one morning with a pain in my backside. And that pain has persisted in some form or other right up until the current day. That was almost 35 years ago.
Mm-hmm.
At that time, I was 13, 14 years of age. You're used to waking up with all sorts of strange things. And the hope was it would disappear or go away in a few days. And sure enough, a few days later, a week later, something like that, I was at school one day and a fella behind me hit me and said, "McGrath, I think you sat in something," because there was a big stain on my trousers. And got out to the bathroom, tried to clean myself up as best as possible, and thought, well, thank goodness that's over. I'm glad to see the back of that. And so I thought I was over it, and sure enough, it came back. I can't remember exactly when, weeks, days later. What happens is you get this pain, it intensifies, this little lump or lesion develops, and it fills up with pus over time. Mm-hmm. This can take anywhere from hours to days to weeks. And eventually you get some relief when the pus or the lesion ruptures and leaks its contents onto your clothing, etc., etc. Then it all happens again. It fills up, releases its contents, you get relief, and sometimes you can go a long time without anything happening. Sometimes it begins filling up straight away. And that cycle repeats. There seems to be no rhyme or reason to it. You can't predict when it's going to happen. And it just comes and goes. And you get these painful leaking lumps in various parts of the anatomy. With me, it started in the backside, but there are some classic areas of the body where it happens. The armpits, the breasts, the groin, the genitals, the bum, the area between the bum and the genitals. Those are the most common, but it can happen more or less anywhere where you've skin. They think it starts with a blockage of the hair follicle, the shaft where the hair begins life and grows and develops over time. And you have those on virtually every surface of your skin, bar the palms of your hand and the soles of your feet. And if you look far and wide enough, you'll see HS on just about every body surface. For the most part, they're in those regions that you can hide from people. But there are some people who get it on the face, on the scalp, on the jaw, on the neck, in the visible parts of the body. And it can be particularly difficult for those. When it does leak and rupture, it tends to stay in your clothing and stay in your bed sheets and the furniture you're sitting on. So this requires us applying dressings to these parts of the body. And when a big rupture or explosion happens, there's no dressing or anything you can apply that can contain the mess. And it does lead to social embarrassment. It's usually in the time you least want it to happen, when you're making a presentation at work. You're in a social setting, you're out with pals, etc., and a stain will appear in your clothing. And I think everybody I've spoken with who has HS has at least several of those incidents where they were humiliated publicly, or they perceived themselves to be humiliated publicly. And whatever about the physical side of it, we live in terror of being found out like that. There's a contradiction going on. We can hide it, but we're constantly in fear of being found out. And the pus and stuff that comes out of you, for many people, it can smell horribly.
Right, okay.
Absolutely foul smell. And, well, if you think you smell bad, the natural reaction is, I'm going to isolate myself from people.
Yeah.
I'm going to stay away from people. And HS, one of the big problems long term is we isolate. And that leads to devastating psychological consequences, loneliness and complete isolation.
Yeah, and whether, it's something you perceive, others perceive, it's that if you know it's there, and it's the way it then makes you feel. I'm trying to think about how it is with my psoriasis. If I get it in areas like my genitals or whatever, the whole of me feels dirty, or I don't want to go near other people, or I might work from home that day, and then that sort of process of isolation begins. So I can really relate to that. And and I think it's really important what we're doing, raising awareness of this, because not doing the sort of pain and discomfort any disservice, that the way, that mental burden, I think is probably the best way to describe it, sounds really challenging.
Two things, Joel. One, so that people at home or who are listening in might be able to relate to it. If you lose a tooth or have an abscess in your tooth, your tongue automatically goes towards that area, and you are always aware that there's something wrong.
Yeah.
No one else can see it, but you are, and you're constantly carrying that around with you. And over time, I've been living with this for 3.5 decades. The physical, and not to diminish it or minimize it, you develop coping strategies on how to cope with the pain, and what you realize your limitations, etc. But it's the psychological burden that I've always struggled most with, coping with that. And you've a lot going on internally, and we haven't been doing ourselves any favors by not telling friends, family, those in our immediate circle. I mean, I didn't tell anyone for the guts of 25 years beyond immediate family, or those on a need-to-know basis. And what I've been speaking openly and publicly about it for the past 10 years, and what I've come to realise is that most people are nice and will want to help if they can, but they can't if they don't know. And you're caught in that catch-22.
Yeah, and in a weird way, you're also like you're contributing slightly like to the stigma, because if people aren't talking about it, then those people that feel isolated feel like it's only them or they're doing something wrong, isn't it? So I think it's really important that we share. That's what we're all about here on Sunday nights, is sharing those experiences. One of the things I want to sort of ask you is, like, obviously this is sort of an overlooked condition, and you said there was only sort of one treatment. And is anyone like primary healthcare, like, is this on their radar? Are they looking for this when if people go into their doctor, with early signs of this, or they might have it in a location? How far away are we from like addressing that, or is that even an issue at all with awareness at sort of primary healthcare?
Well, we have some data. We've been collecting data in our group, and in Ireland, we're similar to the UK. It's a referral system. You go to primary care and they open up the doors to the healthcare system for the specialists. And about 80% of people in our group have their first conversation. It's in primary care about their HS, and they describe the symptoms. Unfortunately, in primary care, there's a very poor awareness of it, and they tend to treat it as a one-off thing. They deal with what's there in front of them then, and they send you packing with a prescription, and you're back again a couple of weeks, couple of months later, and you get caught in that cycle. And once you get into primary care, it can take 7-10 years on average before you finally get that diagnosis. Wow. Now, during my diagnostic delay journey, I lived in 3 countries and access to healthcare in all 3 countries. I lived in the UK for a time, access to the NHS. I lived in the Netherlands, and I saw beyond primary healthcare, I was referred to specialists, and no one seemed to know what to do with me, and you fall through the cracks of healthcare. And it was finally when I moved to a new city. I was back in Ireland. I moved to a new city. I walked into a GP's office, and he diagnosed me within 2 minutes.
Oh, wow.
Because he was aware of it. Because he was knowledgeable. He'd spent some time in surgery, and surgery is part and parcel of treatment for a lot of people with HS. And because he'd had that experience, he was able to diagnose me. Now, it was almost 20 years to get to that point, to meet the right person who was able to do it in 2 minutes. And it was just a couple of questions, and he'd a quick look, and that was it. And that still sticks in my throat, that how come it took so long to get to that point, to meet the right person? But there's a quote that I read from one of the HS papers a number of years ago. If you don't know about HS, you're not going to be able to diagnose it. No. And it's this chicken and egg situation, that because they're not necessarily talking about it in primary care, they see a lot of it, but they're not joining the dots, or it hasn't been. No one has been doing it. Now, there are many initiatives happening. I'm privileged to be able to work with a lot of HS specialists, industry people, researchers around the world, and there are many initiatives in the background happening to try and connect all those pieces to get the person to get into primary healthcare. Then when they get to primary healthcare, to make sure that primary healthcare physicians know about HS, and then to get them out to the right specialist. It was this multi-pronged approach that I mentioned earlier. In my own case, and whatever I tell you about myself, it's reflected and mirrored everywhere we go. It was about 2 years before I plucked up the courage to go into the GP. I was a young guy, 13, 14, it was happening in my backside, and the thought of going into a doctor's clinic and showing someone my backside was an absolute horror. Yeah. And again, because it affects the intimate areas of the body, it tends to kick in teenage years, early 20s. And you're asking people to go into a stranger's office and show them your bits and bobs and your most intimate parts of your body. That's a difficult thing to do.
Yeah.
It's very difficult to get that. And there's data emerging. It takes about 2.5 years for people to actually take that first step.
Yeah.
And when you take the first step, invariably the person you see doesn't know about it. And you have to see 5, 6, 7, 8, 9, 10 physicians before you finally get that diagnosis over a long period of time.
Yeah. And we know from other conditions as well how that can add to the diagnostic delay when people have that bad first experience, don't they? Like you say,
Absolutely, yeah.
you're talking about very personal areas, and if it isn't a great first experience, then who knows how long those people go away and not come back for. So
Yeah, like most things in life, the first experience dictates the rest of the experiences afterwards.
Yeah, and it's really, really fascinating. And one thing I want to ask you is, you did mention earlier, kind of like no rhyme or reason, but
Mm-hmm.
is there any known sort of triggers, or is it just completely random?
Well, it seems to be a very personal thing. And one thing I'd encourage anyone who's new to it, keep a diary.
Mm-hmm.
And work out things for yourself. With certain people will emphasize foods. Certain foods tend to trigger it. Personally, I've never found that, but it seems to be different strokes for different folks. Stress seems to be pretty much universal amongst everyone with HS, and indeed with a lot of immune-mediated conditions and so on and so forth. But look, stress is a part and parcel of life. You can't avoid it, and a little bit of stress is a good thing. It helps you get out of bed in the morning, but you want to make sure that you can manage stress accordingly such that it doesn't break you. That's the danger. There are some underlying causes. In about 1 in 3 people, there seems to be a family connection, so it's genetics going on there. Particularly in females, there seems to be a hormonal influence. Quite a few females, it only ever happens with their first pregnancy. Some females go into remission around the time of menopause.
Okay.
In contrast, some females only ever develop it post-menopause. Many females report around the time of their period that it intensifies, it gets worse, and they tend to have more flares around that time. So there's obviously some type of hormonal influence going on in many people. There are some other triggering factors. I think cigarette smoking can be a trigger. A few other bits and pieces like that. So there's no one size fits all here. And over time, you've got to try and work out what's going on with you and minimize the triggers, the sparks, and so on for yourself.
It is really eye-opening. Of all the conversations we've had on this show, of all the various different stories and conditions we've talked about, this one, it really does feel like the odds are stacked against you getting that help. And then once you get that name, obviously you said there isn't that many options out there. Can you tell us a little bit about the treatment side of it?
Luckily, Joel, I will add a caveat there. That landscape is evolving rapidly. I was at a recent HS conference and there was lots of data about new medicines that are at late stage development and close to the finish line. And if even a fraction of those get through, we'll have more treatment options. Just last year, a new treatment option was approved in the US, the UK, in Europe, and in most of the main markets. So now there are 2 approved therapies that your consultant can prescribe for you. Overall, about 50 different treatment options are on the table. They tended to just throw everything on the table, and it seems to be a case of trial and error to find what works for you or what combinations of treatments work for you. As well as medicines, I alluded to it earlier on, surgeries are a main component of treatment for a lot of people. I've had multiple surgeries, as have many others with HS. Some people thankfully never get to that stage, but the surgery is quite a brutal process. They tend to cut out the affected area and plus some healthy skin in the surrounding area. And depending on who operates, how deep and wide they operate, and crucially, the aftercare, depending on numerous factors, that can help. And for a lot of people nowadays, it seems to be a combination of surgical approaches and medicinal approaches, depending on what kind of state you're. But again, Joel, just reflect back on what areas of the body are affected. You're talking about, I had multiple operations on the backside, and that's quite difficult afterwards, going to the toilet, etc., etc. A lot of care is needed afterwards, and you get dressings changed every 2 to 3 days, depending on how deep and wide the cut. This can go on for months, and for quite a lot longer.
And
For
psychologically, that has its
yeah,
impact
and
as well, doesn't it?
when you're had an operation like that, you're very limited in what you can do afterwards. So there was long periods out of work. Many people are losing work if they're in a type of job where they cannot adjust, and it might be a small operation with just a few employees. They can't afford it. If I'm out every second week or for long periods due to surgery and someone else isn't, or they can get someone else who isn't, well, of course, that's going to happen. Lots of people who are in what you might call the blue or pink collar jobs, they're losing their livelihoods over this because of extended periods out of work. There were several years where I was out of work because I was going from surgery to surgery. It just seemed to be never ending, one surgery after another. They'd tidy up one area, I'd recover a few months later, and then it would kick off somewhere else and back in and through the whole palaver again. And that takes a tremendous toll mentally as well. Because when you're not working and you're reliant on social welfare, etc., you're not contributing to society. Most people want to do that, want to be able to make a contribution, and you feel like you're a tremendous drain on society, and that does not do your mental health any favors. If you're reliant on others for everything, for practically everything that you do. But again, that's all changing. It's rapidly evolving. New medicines are coming on stream. A lot of the surgical options, they're becoming more refined and so on, and they can do procedures within a dermatologist's office and have you in and out within a couple of hours and have you back in your feet. And it's like going and take an afternoon off work to have a minor procedure done. That can keep you going for a while at least. So it's an exciting landscape right now. For a long time there was very little, but now options are becoming available, and we're often told by consultants that we're a generation or two behind psoriasis. They say that when someone comes in with psoriasis now, they can offer them a suite of different options.
Yeah.
And that's what we'd aspire to, and that's where we hope it's all going. There's been an explosion in HS research. Almost half of all publications on HS research have been since 2020, would you believe? It's just mushroomed in the past few years.
Yeah. Well, I say I was almost embarrassed that it just not was on my radar. For someone, I've been advocating for several years now, and obviously I've lived with psoriasis for decades, and to have no crossover with this condition until the last year, and it piqued my interest. And the more I sort of dug into it, the more I realised how such an unmet need was there. And like you say, you've got all of that. The treatment difficulties. I probably there's hope there now for the future, and some of them are quite brutal options. And you've still got that 5 to 10 year delay in actually even getting to that point. That's a real impact on quality of life, doesn't it?
A huge impact. Like most things in life, the sooner you can get to meet the right people. There aren't a huge amount of HS specialists. And the ones that
was actually going to be my next question. Is it dermatology, or are there sort of specialists in that, or is it just an emerging thing?
For a long time, we fell through the cracks of healthcare. I saw numerous specialties down through the years, but now, thankfully, for the past decade or so, we've found a home within dermatology in combination with, say, plastic surgeons for the specialty surgery. But by and large, we're managed by dermatologists who will also refer us to other specialties on a per need basis, like the plastic surgeon, like the rheumatologist. There are quite a lot of inflammatory arthritic conditions associated with HS, like psoriatic arthritis. Very high proportion of people with HS have that. Gastrointestinal disorders and a whole host of other associated conditions. It would appear that having HS is opening up the door to a lot of these other conditions, and there's a huge, what they call comorbidity burden, associated illnesses. So much so that there are some registry-based studies that reckon people with HS have a shortened lifespan of about 15 years compared to the general population because of all these other complications and the toll it takes in your body over time. So then that re-emphasizes the importance of getting diagnosed as early as possible and then getting to the right people who can open up the doors to the healthcare system and get you to see the right people.
Yeah. I really appreciate you sharing all that, and I think that comorbidity is a really important one because from my background, obviously slightly different disease, we're behind on that. Recognizing that things like psoriatic arthritis comes with male obesity and cardiovascular issues and this sort of thing, and they're finally getting accepted into even just getting some of the mental health things in there. I imagine there's probably some crossover there with HS in that
Sure.
depression, seeing it as a comorbidity rather than just somebody isn't coping well with this condition. It's a comorbidity. So that is an area that does seem to be picking up speed now, thankfully, but it's taken a long time, hasn't it?
I'm glad you brought up depression, because anxiety and depression are quite high in the HS population, and as a consequence of that, and it's something that ought to be talked about and mentioned, completed suicide levels within the HS population are higher than the general population.
Yeah.
People are have been at such a low ebb with it that they've ended up not wanting to go on. And I was there, Joel. I've had a few episodes, and I'm thankful that I got through it. It's the cliche that you didn't want to die as such, but you just wanted the pain to stop. And it wasn't just the physical pain, but it was the mental pain, the emotional pain, etc., etc. There was times I would have done literally anything to make it all stop. And it's important to mention this because some people are in such dire straits with this that they're going to extreme lengths. And all the other comorbidities that we mentioned, cardiovascular, gastrointestinal, there's some way back from those.
Yeah.
But with suicide, there's no way back.
No.
It's a one-way ticket.
Yeah. Yeah, I can relate to that more than you know. And I think from everything I've learned in our short time, getting to know you, Barry, and how inspirational you are, I'm also very grateful you are still here talking about this and doing the work you are doing. So keep up all of that, and thank you so much for sharing all of that. I really do appreciate it. I wanted to allow a little bit of time to talk about the organization you sort of co-founded, and that I'm somebody that's sort of a big proponent of patient organizations and the role that they play. I could probably guess why this was founded and the timing and everything based on what you've just shared. But do you want to tell us a little bit more about the founding of HS Ireland?
Well, we started off on Facebook. A few of us got together and got something going. We just wanted to create a safe space. And our numbers are growing, and they're growing rapidly. And it's always bittersweet when someone new enters the group. You're devastated that someone has ended up there. But on the flip side, one comment we always hear is, I am so thankful I found you, because I've been alone with this for so long. I haven't been able to talk to anyone. We try and create a safe environment where people can relate to others and share common stories. And it can be a revelation for many to say, well, I've been experiencing this. Has anyone else had it? And people will respond and you go, oh, crikey, others are feeling the same way. I feel somewhat validated. And you can't put a price on that. People who've been dealing with something by and large by themselves for such a long time, being able to meet with others. And HS in particular, it's conducive to online, because nowadays when people develop their symptoms, they'll go online because you can search for information privately, anonymously. And you don't have to ask those questions out loud or go into that GP, which may frighten some people, etc. And within this space, is something you mentioned earlier on. We take the information that's shared there very seriously. The quack cures, the snake oils. We don't tolerate that type of nonsense. One of the best things we do within the group is, I find one of the most beneficial things is, we point people towards, there's a specialist in your town or your city. Ask to be referred to Dr. So-and-so immediately. They'll look after you. And we're a fantastic resource because people are going in through the traditional routes in health care. And it depends on how well up to speed your GP is, and GPs, God love them, they've a hell of a task. They've so many different conditions that they've got to contend with, and they've tried to be up to speed with all the various disciplines. We know where the HS specialty clinics are in Ireland, and we can signpost these to people, or signpost the resources that they need and that they will find most useful. I got it by word of mouth, and the old ways I was going into libraries when I was back in the day and looking up indexes at the back of books, trying to work my way backwards. Nowadays, with digital technology, you can share this information instantly. And I guess another thing about the patient group is that we have a lot of parents in the group, because you'll have teenagers, children even, who have HS, and it's invariably their mums who come into the group looking for information. And there's a comment I hold dear to my heart. A mum came into the group a few years ago, and she said, "I've learned more here in 10 minutes than I've learned in 3.5 years seeing a specialist." Because we're able to fill the gaps about, she might see that specialist once every 6 months, once every year. We're able to help them with all the other days in between, the day-to-day stuff, the practical stuff, and share bits and pieces of information. And I think we are filling huge gaps in that regard, helping people with the day-to-day stuff, as well as signposting them towards the specialists and the healthcare resources that do exist. I think also, as a patient organisation, it might be easy for someone in the Department of Health to ignore a letter from Barry McGrath or an email from Barry McGrath. But if Barry McGrath is writing on behalf of 1,300 people, which we almost are now, they have to sit up and take notice, because your voice becomes stronger when you do things together. And this is where patient organisations can make a difference. I recall speaking with a HS specialist in Ireland a few years ago, and I mentioned that HS Ireland, we were going down the route of becoming an official organisation, etc. And they looked at me and smiled and said, "The health authorities here will absolutely hate you," because strength in numbers from that perspective. And they said, "If I can help in any way, please let me know."
It's just like I say, I love that, and I can we get certain themes on this show, and that when you bring people together, like I say, we exist as a peer support community first and foremost before the interviews and everything, and like there's so much power in that, and I feel like it's such an I don't know, perhaps today it's not underutilized, but it's certainly overlooked, much like I suppose HS itself, in that power of community, collective voice, collective experience, and what you can do with that when it's coordinated properly. And you're clearly leaving an impression.
One other thing is, I spend a lot of time at weekends going visiting people within the group, meet them for lunch or a cup of coffee somewhere.
Oh wow!
And those are quite emotional moments for everyone, because for many people, it's their first time meeting in person with someone who has it. And I always learn something from these interactions. Just being able to relate to someone, they've a lot of stuff bottled up for many, many years, and being able to share these experiences and physically interact with someone across a table at lunch or something like that, who knows what you're talking about and who understands. It's an incredible moment, and it's a revelation every time I meet with someone who has HS. I learn as much from them as they from me, because I'm learning about their coping strategies, and they're telling me about things that 1,000 of me at 1,000 typewriters for 1,000 years would never have come up with. It's a two-way thing.
It really is. I often talk about, when people ask me about advocacy, I say I'm selfish. I do it because it helps me as well. There is definitely that element to it, and I can really relate to that. So we now do sort of like community meetups where we do it purely to not even maybe talk about the condition, more that so that someone can go out, and if they're struggling or they have a moment or a wobble, they don't need to make an excuse. They don't need to justify it. If they have to leave early, it doesn't matter, because they're around other people that are in that exact same boat. And I feel like that's like the future with what we can do with peer support and what patient organisations can offer, and the fact that you guys are already there, I can't tell you how special that is. I genuinely like that's a subject I've been trying to champion for a long while, and you're already there. So I think you deserve to give yourselves a lot of credit for that.
But in terms of something you mentioned earlier on is there are a lot of patient organisations that are further down the road than we are, and there's, for instance, the psoriasis community in Ireland have been very generous with their time and support in helping us, sharing lessons learned. Oh, don't do it this way. We tried it that way. It didn't work for these reasons. Consider doing it this way. And a lot of other patient organisations, doesn't matter what area they're working in, are very generous with their time, because we're all at different stages of the journey. We all help each other along the way. And I just wish to highlight that.
That's really refreshing to hear.
Yeah, don't be afraid to anyone out there to contact whatever group it is that's in your locality. They are by and large fantastic people, like-minded people, all trying to do good stuff, great work, and they will help if and where they can.
Yeah, that's just, like I say, really refreshing. Thank you for sharing that. It's something that we try to do here in terms of not like reinventing the wheel and collaborating, and especially post COVID, we've got such limited access to funds and people's time and attention these days. It's the best use of resources and the way we get to where we all want to get to together. So thank you so much for bringing that up, Barry. I'm very conscious of time. You've given us so much tonight and shared so much. I feel like I should ask you where people can find that Facebook group, or where they can also find other things that your organisation offers. Do you want to give that a quick plug?
Well, a good place to start would be our website, hsireland.ie. That's links to all our social media platforms, our Facebook groups, everything you want to know. There are quite a few. We work closely with a lot of our sister organisations around Europe and internationally. And if you Google HS patient groups, they'll bring you to that. And we'll signpost you to those. If you drop us an email, all the details on our website, we'll happily share those. I mean, again, it's one of the revelations of the digital age, being in contact with people on the other side of the world at the touch of a button, all doing great things. And again, we're all sharing information, what worked, how can we use what they did in the Netherlands, for instance, and incorporate it into the Irish context, and vice versa, and what are they doing in France, and what can we learn, and so on. And thank you, Nietzsche, for popping that link into the chat.
I thought that would appear at some point. She's very on the ball with sharing links. And anyone that's listening to this back on the podcast, we'll put those in the show description for you to find access to Barry's work and organisation. Barry, I knew it'd be amazing just from our pre-show chat, but also from getting to know you over the last couple of weeks. And I'm only sorry we haven't crossed paths earlier, because it feels we now know as well we've definitely been in the same place at the same time on at least one occasion. So hopefully going forward, when we're at the sort of dermatology conferences and everything, we can get together and catch up and see how else we can help each other.
I definitely hope we can, Joel. It'll be a pleasure.
But thank you so much for sharing. Is there anything else you want to say, or any sort of final thoughts for somebody that's maybe newly diagnosed, or any other links you haven't shared to resources?
Sure. A few things, and 1 and 2 are depending on where you are. Get yourself a good medical team that know what they're doing, because that's key. Having a good team helping you and surrounding you is key. Depending on where you are, find a HS patient group, because they can signpost you to a HS specialist, or the medical team can signpost you to a good patient group who will help support you. Find out what works for you. Keep a diary. What triggers for you, what doesn't. The second last thing I want to say is look after your mental health. The first Director General of the World Health Organization came out with the slogan, there is no physical health without mental health. They're inextricably linked. The world's waking up to that. And finally, educate yourself, inform yourself, and advocate for yourself. Speak up for yourself in everything you're doing, whether it be at work, in healthcare, and whatever aspect of life. Speak up for yourself. No one else is going to do it for you. And you've got to take ownership of this.
Amazing. And those 2 minutes right there, Barry, is why so many people speak so highly of you. I'm not just saying this, genuinely, I've not had so many messages about somebody coming on the show telling me what a great catch it is for us and how great you were going to be at speaking. And so from lots of people on LinkedIn and other sort of advocates and professionals are very much looking forward to this one. And we can all see why. You speak brilliantly. You're doing amazing work. Thank you for everything you're doing for such a such a life-changing but also overlooked condition. And yeah, like I say, if there's any way we can help here, our little community, raise more awareness with you in the future, then please do get in touch. You're welcome back anytime.
Thank you very much, Joel, and thank you for doing this and for all you're doing as well. It's a great show, and you and the guys here are helping so many people also.
It means a lot. It's my pleasure. Thank you, Barry. Enjoy the rest of your evening.
You too. Take care.
Bye-bye.